Nancy Bradley. I'm a clinical associate professor at the Midwestern University College of Veterinary Medicine, where I am a clinical associate professor in shelter medicine and veterinary forensics. It's been really my honor to work with the Shelter Guidelines Committee. So shelters are involved in community outreach and act as a safety net. My 18 years in shelters, we've seized animals or they've come through our doors. It's important to understand the mandatory reporting component of many states. And a lot of shelters have vets on staff. So this is really important, not only for the vets to understand, but for their staff, specifically the intake and admissions personnel, the humane investigators or the ambulatory drivers in the field. 35 of 50 states in the United States require some form of mandatory reporting for veterinarians. So it's important for the staff to be aware of this, because this can impact the shelter veterinarians, even your contract veterinarians. This can have an impact on them. A lot of mandatory reporting states do have civil liability protecting vets if they report in good faith, but that's not always the case. So it's really important as animal welfare professionals that we do recognize and report when we believe that we see animal cruelty, just so we stay in consistency with our local laws. So when receiving abused animals, how do you treat them? If you can't treat, where do you send them? The types of investigations that you may directly or indirectly become involved in, with no matter what capacity demands on the shelter. The number of animals with hoarder cases can be dramatic. Length of stay, even with one animal with a gunshot wound or a neglect case, could take weeks for that animal to recover sufficiently. So the demands on your organization's capacity for care, your staff, your resources, how this affects other animals within the shelter that you're already trying to provide for. So this is a big undertaking if this is something that your organization is going to do. As a shelter, when you're working with animal cruelty type cases, it's really important to define your organization's scope of involvement. So what kind of services are you going to provide? Are you going to do full-on investigations with law enforcement where you have people respond to the scene? Are you just there for receiving the animals, transporting the animals somewhere else? You really need to define the parameters of what type of endeavors that you're going to be involved in. You need to define the parameters of what types of species and geographic areas. Are you specifically only going to answer in your community? Are you going to assess in the county or throughout the state? How does that affect the organizational resources? Are you able to do that? And then your memorandums of understandings, your MOUs, contracts. These activities cost a lot of money and time for caring for these animals. So who's paying the bill? Who's paying the freight for all this? Working with law enforcement agencies in the field. This is Detective Krim and her dog. She was a close friend of mine. I've worked with her probably for 12 or 15 years. And it takes time to develop these relationships. Sometimes it takes a while for the police officers to get to know you and your organization and appreciate what your shelter, your animal welfare organization brings to the investigation table. Your organization really has to work diligently to build these critical relationships. Where I work, animal control does not perform animal abuse investigations, but they have assisted and been invaluable in helping us with transport of animals and hoarder cases, just as an example. And they've assisted us with other things as well. When you're evaluating each of these animals, is this truly animal abuse? Sometimes it's blatantly obvious, sometimes it's not. It takes some education on the part of the folks that are involved in these case investigations. What about access to care? What about the history? Is it making sense or is it not making sense? Are your spidey senses tingling with this? The types of injuries, are they explainable? Are they not explainable? Maybe this does rise to the level of reporting to law enforcement entities. So this is an overlay of a forensic investigation. Basically, you're conducting a physical exam like you're trained to do, like you're familiar with doing. You're doing a full physical exam on these animals, but at the same time, you're trying to preserve, document, and collect forensic evidence. If it's there, you need to determine if it's there and how potentially to collect that. Documentation. This is absolutely critical. When we talk about the actual exam itself, we need all of the information and documentation we can access. You know, do we have a police report? Do we have a history from documentation and access, you know, the intake information, the history, if any. A lot of times we're not going to have a whole lot of history. Any medical records that we're generating, are there any from the ER or other transferring hospitals, especially in a shelter? A lot of times we receive these animals from other places. We want photographs. This is my little dog Dude. Even in a neglect case where there's usually no visible injuries other than the dog being very, very skinny, there's a loss of weight, but you want a series of photos. You want a photo with a placard regarding the case information. This might have address, it might have the law enforcement direct report number, animal ID number that's assigned by the humane or by your shelter. And you want different views of the animal. You want left, right, this kind of switch this around a little bit, but you want left, right, front, back, top, and bottom. And then depending on if there are injuries, you're going to want both before and after treatment of those injuries, and with and without measurement to document your case. Just pictures like this in a neglect case taken weekly with daily weights can make your case as the animal begins to recover. So the shelter needs to be able to effectively manage evidence. Depending on the type of evidence. Now, the animal is obviously a very important piece of evidence, and then that's where the shelters or animal welfare organizations are becoming involved. But other forms of evidence, you need to be able to securely place them. My word of advice is any form of evidence that is not directly related to the dog itself, you need to get those things to law enforcement as soon as you can. Let them keep those in their property rooms. So the animals themselves are evidence, and they're considered property in most states. Even if your organization is simply keeping and holding them, you need to maintain them in a secure manner. So is our shelter facility secure? Is there a chain of custody in the event we find evidence on the animal? For example, a blood-stained collar. If we blacklighted the animal, did we identify any form of forensic evidence that might need to be collected? And so that could be blood, that could be saliva, that could be anything potentially from a human suspect or victim. So that needs to be collected either by law enforcement or by our shelter staff. So is our investigative or staff able to do that? They may not be. They may not have the education to do it. You know, is our staff trained to do that? Because they might be called to answer to this in court. In the event the animal is deceased, we want to refrigerate, not freeze. Believe it or not, a lot of our colleagues don't know that, especially our ER colleagues that transfer these things to the shelter, and then we send it on. But please refrigerate. I can't stress that enough. So, because law enforcement's not going to know that as well. So if we have a deceased animal, a necropsy must be performed. Are we able to do that in our shelter with our vets? Do they feel comfortable? When I was a shelter vet, I did it for years. I know a lot of vets that feel very comfortable with it. Or should we send it to a veterinary pathologist, preferably who has experience in veterinary forensic cases? So are we going to send that to a university, a vet school? Are we going to send it to a state veterinary diagnostic lab in the event our state doesn't have a vet school? So Appendix D in the guidelines, it's on page 73. The literature here, this is probably some of the most current that's out there right now. These are papers and books, most written in the last 3 to 5 years. Although there are some older books, there's a lot of really good literature out there beyond this, but this just happens to be some of the more recent. There's organizations, the American Academy of Forensic Science, the International Veterinary Forensics Association, the American College of Veterinary Pathology. But training can also be obtained through local medical examiner's office, through law enforcement, specifically crime scene investigation type trainings, and forensic nursing as well. I've had nothing but positive experiences working with these types of entities. It's a great way to get your foot in the door and begin to form those professional multidisciplinary relationships. Just to kind of summarize everything, I would really like to thank my co-authors of this section, Martha Smith Blackmore and Janetta Quinn. It was absolutely an honor to work with these ladies. If you have questions, I believe there will be an opportunity to discuss at the end of the presentations today. I hope you have a great day. Unfortunately for us, this does come to our door whether we want to or not, and we have to deal with it. So thank you.
Hello, everyone. My name is Lena Datar, and I am one of the editors of the second edition of the ASP guidelines and one of the authors for the public health section. And today I would like to talk to you a little bit about public health and how that plays into our work in animal shelters.